Welcome to our continuing 2020 educational webinar series. I am Catherine Short, Partnership Marketing Manager for First Healthcare Compliance. At First Healthcare Compliance, we help you with a comprehensive compliance management solution tailored to your business. A hospital, hospital network, healthcare practice of any size, billing company, or skilled nursing facility, and we help you manage every aspect of a compliance program, and our training library provides hundreds of modules that are easy to assign and track. As part of our complimentary educational webinar series, we bring you experts from around the country to discuss relevant topics in the healthcare industry. This webinar is brought to you by First Healthcare Compliance as part of our commitment to provide high-quality complementary educational resources. We create confidence among compliance professionals throughout the United States. Please show your support by taking a few minutes to provide a review of First Healthcare Compliance on places such as Google or Facebook. And you can follow us on Instagram, Twitter, and subscribe to our YouTube channel, where you will find archives of our webinars. We are so pleased to have Grant Elliott, President and CEO of Ostendio, a collaborative and integrated risk management SaaS platform. Ostendio works with hundreds of companies and thousands of users to build security programs that are audit ready for complex audits such as SOC2, HITRUST, FedRAMP, and HIPAA. He is a thought leader in enterprise cybersecurity and speaks regularly about how organizations can implement effective cybersecurity programs. Elliott is the former COO and CISO of Voxiva, acquired by Welltalk, an integrated messaging and patient engagement platform, and former business executive at AT&T. He has over 15 years of experience developing and managing cybersecurity programs and supporting regulatory audits. Elliott is also an adjunct professor at the Pratt Institute, New York, where he teaches management theory and leadership. A copy of the slide deck is available for download on the control panel. Feel free to submit questions into the question box on your control panel during the presentation. We will address questions at the conclusion of the presentation. Your PAYCOM and PMI CEU certificates will be emailed to you following the broadcast. Your PAYCOM certificate will come directly from PAYCOM, and your PMI certificate will come from our email. There is no need to request either one. Additional CEU opportunities will be available to BC Advantage members following the live broadcast. See their website for details. A download of the handout is available with a button on the side panel of your screen. So Grant, a very warm welcome. Thank you for being here.
Thank you very much for having me, Catherine. Pleased to be attending.
Thank you.
Okay, let me start again. As Catherine indicated, I'm going to do a quick overview of kind of HIPAA generally and a little from the updates of the current situation we're in with COVID-19 in 2020. I'll do a quick recap of HIPAA itself and the general law. I spent a little bit of time talking about the intent of HIPAA because I think sometimes people have a different perspective of why it exists. Moving on to, again, one of the really important aspects of conducting a risk assessment, a little bit about, again, how HIPAA is being adapted in the current timeline of COVID-19, and then we can finish with some conclusions and recommendations. So let's start off with a quick recap, right? Most people are familiar that HIPAA has been around for a while. It was originally actually signed into law back in 1996. It stands for the Health Insurance Portability and Accountability Act. And the reason I kind of spell that out or read that out is because obviously the first intent of HIPAA was to really allow for people to gain access to their medical records. When people were moving from one side of the country to another and they're going to the doctor and they wanted to get their medical history, when law was implemented that required organizations or patient hospitals to make sure that they sent people's patient regulars without a significant fee or charge. They found that actually facilities were simply just shipping them in boxes and there was no security implied, and so people's very sensitive information was getting lost, was getting mislaid, or was being accessible. So really, kind of HIPAA, came out with two specific reasons. One is, again, to make sure that people were able to maintain continuous coverage if they moved from one medical provider to another. but also to try and make sure that they were able to kind of reduce these costs of maintaining the electronic nature of that information and the security of that information as well. The main component of the HIPAA regulation came out in 1996, as I stated here, but there has been updates throughout during the course in terms of guidance that's been issued by the Office of Civil Rights. But probably the biggest change that came out was, again, back in 2009 as part of the American Recovery and Reinvestment Act, or HITECH, which was the component of that law. And within that, there were some significant changes to the existing regulations that I want to cover. The first was around the breach notification rule, and they basically made some changes around there. The second one was the final omnibus rule, and that was really important because they changed the concept of what a business associate was and when you qualified to be a business associate. I'm going to cover a little bit more of that later on. And then the last thing that really kind of came out of HITECH was this concept of meaningful use. And meaningful use basically being the requirement for organizations to be able to demonstrate and digitize their information. If they spent money making their information of their personal health records digital, so the electronic medical health records digital, then they would qualify for payments that fund that. And that's obviously the big impact of HIPAA, and I'm going to, again, dig a little bit more into that as we move forward. So again, really kind of going into what HIPAA actually does, as we mentioned. The first real point of HIPAA is to protect the privacy of a client's personal and health information. Again, privacy is an important concept to this. A lot of the focus is around the privacy because people are providing and giving over very personal information about themselves and their medical history. As we've transitioned more of this information to digital information, again, the idea is to make sure we want to make sure that we're digitally protecting that information. And there were some other guidance in the law about how we simplify billing and transactions. The construct of the law is actually quite complicated, and this chart tries to kind of break it down into different elements because, again, I think most people simply think about HIPAA as just this thing that we have to sign when we go to a health facility, and I think people do obviously associate it with security and privacy, but there's a lot more to it in terms of the basic construct. Obviously, we talked about portability, which is type 1, so Title 1. Again, there's a requirement for health facilities to actually maintain health information of the patients, but more importantly, to be able to share that information with, as a patient moves from one provider to another provider, be able to share that information. Most of what we're going to talk about falls into Title 2, which is based around administration simplification. You can see here with the subcomponents in here of the privacy section and the security section, as well as some guidance around how we basically manage electronic data transmission through that process as well. And then there are other elements, obviously, to HIPAA around, we talked about medical savings accounts, group health plan provisions, and revenue offset provisions, which we're not going to cover in this presentation. We're going to really focus into, again, the administrative components. Now, I'll give you an example of some of those elements, just as a kind of high-level view of the types of things that are included before we kind of dig down into more of the intent of the law. So, for example, HIPAA specifies very clearly that someone has to be responsible within the organisation for managing the security and privacy of the information. That's different to a lot of security frameworks. A lot of security frameworks might require responsibility to be assigned at a component level. HIPAA is actually very specific, and it says that there must be a person within the organisation who has this responsibility. You need to be able to assign someone, and the organisation needs to be pointed to something, and requests and communications need to be directed to a nominated or named individual within the organisation. HIPAA sets out some very broad guidance and regulations around training, and so it requires training to be conducted around both HIPAA and general security and privacy, although it doesn't really do a very good job of specifying exactly what that training is, so there's a lot of room for interpretation within that. But again, if you're looking to operate in accordance with HIPAA, you have to demonstrate that you have a training program in place that is adjudicated to be effective. Obviously, there's some other things there around business associates. Again, what defines a business associate, what a business associate is permitted to do. And so, we're going to cover this concept of covered entities versus business associates. A covered entity is obviously the entity, and for the most part, that's is the preferred providing the health capability, although it also includes payment services as well. And so they rely on subcontractors in many cases to do some of those services, which would potentially constitute as being a business associate. And so HIPAA specifies some key criteria that needs to be in place when you are subcontracting some of those services out. Again, the other area, verifying the identity and authority of person requesting PHI. Some of these things sound like no-brainers, and they are pretty straightforward, but they have to be specified in the law. And so the idea really is that there are very specific guidelines around who can suggest for information. So again, obviously a patient can request their own information. You have to make sure that you take appropriate actions to ensure that that is the person that's asking it. There are also legal reasons that, for example, the police or the government can ask for that information, again, if they have appropriate legal requirements to do so. And so a lot of that is specified out both in the law itself, as well as some of the documents that you put in place with the various entities involved. Being able to communicate effectively with patients and with stakeholders around what your privacy policies actually are, making sure that information is available on a recurrent basis, again, is important and specified in the law, and making sure that's done in a reasonable period of time. And so I'm not going to go through all of these. You can read them yourself, but you can see there are many, many more reasons of this, or elements than this, within the law itself. And so it's pretty comprehensive in terms of a lot of the areas that it covers, albeit you can see some of the directives themselves, while they're comprehensive in nature in terms of scope, sometimes leave a lot to be desired in terms of the detail that's involved in meeting that particular requirement. Fundamentally, the most important aspect to take away here, though, is when we think about who does this apply to, we can have a broad conversation about what a covered entity is, what a business associate is, but if you find yourself within this environment, everyone has to follow HIPAA. There are no exemptions, right? I used to get asked the question sometimes, can you opt out of HIPAA, right? And the interesting thing about this regulation per se is that it defines the situation that you find yourself in. And if the situation qualifies for HIPAA to be applicable, then it applies. There is no way an individual can sign a waiver to basically say, hey, I don't want HIPAA to apply to my information. An organization can, write legal exemptions into their contracts to basically say, hey, HIPAA doesn't apply to, as if it does. Employees, subcontractors can't say that, hey, we don't agree that we fit in this situation, therefore it doesn't apply to us. The interesting thing about HIPAA is, and this was made even more clear as part of the high-tech final omnibus rule, is that if you operate in line with HIPAA, if the government determines based on the way that you're operating that HIPAA applies, then HIPAA applies. It really doesn't matter what type of contractual documentation. And I'm going to cover that in a little bit more detail further down the line. So, who is impacted? And this is obviously like a high-level element. So, first of all, we talked about healthcare providers, so hospitals, doctor surgeries, pretty much any provider of some form of medical, psychiatric, or other health service. Again, if they're providing some level of care, is a good way to look at this, then they're likely to be covered. Obviously, that care has to include the concept of health information, invariably does, and in that situation, and obviously HIPAA will apply. Health plans, so insurance services, again, because they're involved and they have to have access to information around treatment, diagnosis, etc. They have a lot of sensitive health information, and again, so they're covered within HIPAA as well. And then clearing houses, right? Billing exchange, billing companies, etc. Lots of other third-party organisations that again are effectively processing healthcare information. Again, they're applicable. And generally speaking, these three elements are what you're going to define as a covered entity. Again, they're the organisation that's actually providing the direct service. And then the third part, or so the fourth part here is business associates and trading partners. And again, for the most part, think of them as subcontractors to the covered entity. They are organizations. They might be providing translation services, they might provide cleaning services, and they might provide some sort of technology capability or solution on behalf of the covered entity. And again, we're going to start getting into a little bit of technical terms here. It really is, you only become a business associate if you are actually performing that task or that transaction on behalf of a covered entity. A business associate cannot exist in its own right. You can't become a business associate if you're not doing work for a covered entity. If you're actually providing care, then you're not a business associate, you're a covered entity. But if you're performing on behalf of the covered entity, then you're potentially a business associate, depending on what you're doing. So let's kind of build into the business associate part a little bit more, right? Again, as I said, it's a personal entity to whom a covered entity discloses PHI to perform the function on behalf. Now, I want to break that down a bit because this is a very specific definition here, right? If the entity, if the organization is doing something on behalf of the covered entity that does not involve the disclosure or management of PHI, they are technically not a business associate. Now that might seem a bit strange because we have this, used to have this this saying, when you're a hammer in the world, everything looks a lot like a nail, and is not uncommon for covered entities, for providers, for payers, etc., to require all of their subcontractors to sign a business associate agreement. That's not necessarily because the organization is performing as a business associate. Just typically that can be organizationally and structurally that the covered entity just wants to treat all vendors exactly the same. The same way. And so when you're in that situation, you know, it's important to understand whether you are actually operating as a business associate. And again, typically if you look at, are they sharing protected health information? Are they sharing information about patient health treatments or payment information? And are you doing something with that data in conjunction with that covered entity? And if you are, the likelihood is you are a business associate. And again, so you can see some examples of organizations that I might apply to: lawyers, accountants, consultants, accrediting agencies. What we're seeing at the moment is an explosion of tech companies kind of falling into this category, right? You know, a lot of technology companies, where they're providing SaaS services. You know, we're going to talk a little bit later about remote treatment services, etc., telehealth. And so a lot of those organizations now fit into this kind of business associate. Again, to be clear, must have a contract obliging them to safeguard protected health information. This is a bit of a misleading statement here because, again, when high-tech came out and the final omnibus rule, some of the language in there basically means that if you're performing the act, right, to do something, and you have a, you know, you're licensed or contracted to do X, when they talk about must have a contract obliging them to safeguard protected, what they're basically saying is you should have a business associate agreement in place here. But I just do want to point out the absence of having a formal business associate agreement in place does not mean that the business associate is not a business associate, and does not mean that they're not performing as a business associate, and more importantly, does not mean that they're not liable to the federal government. Because again, the big thing that changed in 2013 was the federal government basically said that covered entities obviously will continue to be responsible to them, but business associates themselves become responsible to the federal government as well, right? Albeit the responsibility typically flows through the covered entity, whereas prior to 2013, a business associate was only commercially liable to the covered entity. So the covered entity had responsibility to write a business associate agreement, but the covered entity, if they breached that business associate agreement, was responsible to the covered entity, not necessarily to the federal government. And obviously that changed in 2013. So again, if you're a business associate and you fail to fulfill the requirements within your BA, or indeed you actually simply fail to fulfill the requirements as determined by HIPAA, you can again be penalised by the federal government, not just the covered entity themselves. And again, that's an important point. So even if you do not sign a business associate, and we sometimes see this happening, right? Covered entities, for whatever reason, through an administrative mistake or through not realizing, will enter into contracts or services with a third party, and for whatever reason, a business associate agreement hasn't been signed. In some respects, it doesn't matter because, again, if you're performing in the role of a business associate, you are federally liable either way. Now, obviously, the business associate agreement helps to lay out some of that and clarify some of those requirements for you, but don't think that by not having a BA that you're off the hook. So let's talk a little bit about a business associate contract, because I think this is a really important concept here, right? Obviously they refer to business associate agreement. The most important thing, and I deliberately changed the word here to call it a business associate contract, because I really want people to understand this is a contract, right? And the reason I say that is, even though there's kind of federal components to what we're talking about here, when you sign as a business associate, when you sign a business associate agreement, you are signing a legal contract. So anything that's included within that contract forms part of any supply agreement and framework you have. OCR don't actually provide business associate agreement templates, rather they provide guidance about what should be included within a business associate agreement. That might sound like I'm splitting hairs there, but you're not going to go to the OCR website and download a BAA template. They're going to basically specify, and the regulation specifies, you need to include these elements within your business associate agreement. The reason that's important and somewhat confusing is because it means that most of the time when you receive business associate agreements from different entities, they're going to be a little bit different. Most of the time, in my experience, most of the time they generally follow the guidance that's provided by OCR in terms of what should be within the business associate agreement. However, sometimes some organizations will go a little bit beyond that. And again, going to my point, this is a legal contract. So if the covered entity actually adds additional clauses in there that says that you should do X, Y, or Z, and X or Y, Z is not covered under HIPAA, if you sign that business associate agreement, you still have to do X, Y, and Z, because you're not federally liable to do that, but you're commercially required to do that. I regularly have to review business associate agreements, and I'll often see a significant amount of overreach in business associate agreements. It's not uncommon for organizations to actually use the business associate agreement to add incremental elements to their supply agreement. So for example, typically the breach notification period requires 60 days for an organization to report a breach. Oftentimes you'll find that the covered entity writes in that they require their business associate to do that within 24 hours or 72 hours. Again, there's nothing in the federal guidelines or laws that require a business associate to report a breach or an incident within 24 or 48 or 72 hours. They should be reporting it as quickly as they reasonably can, and their systems allow them to. And so the fact that a covered entity requires them to do it within a time period is not a federal requirement, it's a contractual requirement. And if you sign that, then you're stipulating from a legal perspective that you will meet that particular obligation. Oftentimes, sometimes I also see that organizations will actually write opt-out clauses within a business associate agreement. So they'll have some sort of language in there that will say this business associate agreement will trump any clause within the master services agreement, because again, it's a federal requirement that we have a business associate agreement. But then they'll also write termination notifications for cause and for without cause within a business associate agreement. And again, if you sign that agreement, because it's a legal contract, that is not part of the requirements within the HIPAA regulations, but it's a contract, so you're theoretically potentially giving your customer the opportunity to actually terminate your entire agreement for reasons out with HIPAA as well. So I only offer that out to basically say and understand that, because the government doesn't allow you to download templates, don't provide templates, they provide guidelines. When you're reviewing a business associate agreement, it's important to make sure that you're reviewing it in accordance with those government guidelines. Typically, what I look for when I'm reviewing business associate agreements, I'll look for language that basically says, as defined in CFR 45, whatever. And oftentimes, as long as the agreement consistently refers to the legal definitions set out by OCR and through the HIPAA regulations, most of the time you're going to find that agreement probably is going to be pretty innocent and align with its intent. But if you again see lots of additional definitions in there, really kind of look through for incremental clauses in there that are not required as part of the BA. And again, sometimes that can be a sign that the organisation is using a little bit of discretion and overreach within that agreement. Okay, so again, I think we've covered most of this in terms of the business associate obligations. Again, it must, business associates must not use or disclose protected health information. I mean, that's the whole point of it. One thing I will clarify here is protected health information, or PHI, is a defined term, right? And so, and this gets a little bit technical here in the sense that when people talk about PHI, PHI can only exist in the realm of a covered entity and business associate agreement, or in the realm of delivering health information. If you're providing some type of private service, right, you're not a covered entity, and you have sensitive health information, on even personally identifiable health information, right? That is not protected health information. PHI, protected health information, is a defined term within HIPAA, and it means specifically information that is obviously identifiable, and it's protected under the regulations of HIPAA. And so just understand that, again, PHI does not apply in all situations, but it does apply, again, if it's a covered entity providing health-related services, or a business associate on behalf of the health service. But again, there are many other situations where people tend to use the term PHI, but that's not the appropriate term to be used. By definition, PHI can only be used. And so if you're signing something and it uses the term PHI, just be careful, because again, that has connotations related to HIPAA. Again, there's various different elements here, as you can see here, in terms of why we're going to do it. Obviously we're safeguarding improper use. We're trying to make sure that subcontractors do the same. We also, requirements are making sure that individuals have access to that information, the ability to get information removed after use if required. And again, the above can be true, as I mentioned, whether you sign a BA or not, right? Again, if you're operating in this business associate function, whether you sign a business associate agreement, if you're performing the operation as we described, you have an obligation to protect PHI in line with the requirements set out in HIPAA. Okay, so let's go through some other elements, because I think this is important. First of all, HIPAA is not a regulation. So HIPAA as a regulation is not a standard, right? And that's important for a couple of reasons. One, HIPAA has been written by lawmakers. It's not been written. It was never written by security professionals. And you can see that as you read through the different regulations. They're very high level many times. My favorite example is the one that I talked about earlier on, which is training. The language goes something around the line, you have to provide reasonable training on a routine basis for your staff. But it doesn't specify how often that training needs to be. It doesn't specify or go into great detail about the type of training you have to perform. It simply just defines it as reasonable training. So what is reasonable training? And that's obviously open to interpretation. A lot of organizations we work with, think reasonable training as some sort of annual HIPAA training, maybe some training around the privacy rule, the security rule, some basic security training, etc. And that seems to have kind of evolved to some sort of norm, or conventional norm. But there is nothing in the regulation that specifies that HIPAA, the training should be annual. It simply says it's regular. Now, I would argue that it'd be very difficult for you to argue, for you to make the case that doing any less than annually was reasonable, especially given the focus on security vulnerabilities today and external breaches, etc. But I'd also argue that organizations should be doing it a lot more often than annually. Again, if I'm doing a security audit on an organization, I'm expecting them to be training their organization on security and privacy on a much more routine basis, like probably monthly, because again, there's so much that needs to be trained, and everything from how you handle data to how you share information, how you basically authorize the receipt of information, to phishing attacks. There's a lot of information that organizations should be training their staff to make sure that they're protecting information, and it's very difficult to try and cram all that into a kind of a 2-hour once-a-year training program. So yeah, I would not personally think that once-a-year training is reasonable, but again, many organizations, that's going to be the standard that they go for. The second thing here is There is no such thing as being HIPAA compliant. You see all the time, we see at events, you go to the website, if you actually even just do a Google search for HIPAA compliant, I actually even see organizations issuing press releases saying that they're HIPAA compliant. There is no certification authority for HIPAA. You can absolutely go to an audit firm and you can ask them to conduct some form of audit that allows them to give you an opinion as to how well you're operating in line with HIPAA, and they will certainly do that. They will offer you an opinion letter, but they do not have the authority to actually say that you're HIPAA compliant. They can simply say that, based on what we see, in our opinion, they're operating in line or not, as the case may be with HIPAA. So oftentimes, from my perspective, if I see an organization that actually promotes themselves as being HIPAA compliant, if that's their primary vehicle for promoting their security program, I'll go exactly the opposite direction, because if they genuinely believe that being HIPAA compliant or saying that they're HIPAA compliant in some way is seen as a positive, it demonstrates to me that they don't understand the construct of HIPAA and that they don't understand the construct of security and privacy. Really what we see is organizations who are doing security and privacy well will find another standard or framework that they can use in order to better assess whether they're actually meeting that benchmark, right? Again, as we said, HIPAA is a set of regulations that again are very, very vague, and so it's very difficult to know whether you've actually met the specific interpretation of that regulation. Whereas if you look at other frameworks like NIST, CSF, or 80171, ISO 27001, SOC 2, HITRUST, there are other frameworks out there that do a much better job at clearly defining what you need to do in order to meet that particular standard. And so if an organization really is trying to demonstrate that they're getting where they want, it's a bit like going on a journey, right? And not setting an end destination, or if you set an end destination, it's so vague and it's sort of like, I want to travel from the East Coast to the West Coast. Well, you sort of generally head out the way and you've no idea whether or not you're actually heading in the right direction or whether you're actually going to arrive there or not. But at least in the definition of setting the West Coast, you're saying, well, if I get to the West Coast, I can put a check mark on it because we have a definition of what the West Coast actually is. So again, HIPAA itself is not as clear from that perspective. Really, an organization should be focusing on a standard. Now, you can do with certain frameworks like SOC 2 and HITRUST, you can actually ensure that a framework or regulation like HIPAA is within scope. And so if you go, and HITRUST was specifically created as a framework because of the inefficiencies or the insufficiency of a framework like a regulation like HIPAA. And so again, all of these frameworks and all of these standards have their limits. And again, just because you get certification in any does not in itself mean that you're not vulnerable to some form of security breach, but you're much more likely to have implemented effective and sufficient security and privacy and controls if you follow a defined standard or a defined framework rather than relying on a regulation like HIPAA. And the same really applies to not just HIPAA, but things like GDPR, CCPA. Anything that has a regulation that gives broad direction is very difficult for you to demonstrate that you're meeting that specific requirement without a significant level of opinion. And that's why many of these frameworks exist, because again, they allow you to have a much more measurable way of doing that. So again, my advice to you is, again, if you have organizations that are saying they're HIPAA compliant, again, there is no such thing. The definition itself doesn't actually mean anything, and I would ask you to question them, because if they believe that it does, then that probably actually speaks to their lack of knowledge in the subject. So what is the point of HIPAA then, right? Again, if we're basically saying why even go through the trouble? Well, look, the intent of HIPAA is obviously, as I mentioned, to make sure that organizations are levying some sort of investment in security generally, right? The whole point of it is because, as I mentioned before, without a regulation like HIPAA, organizations are left their own self-motivation as to whether they actually want to do it. And so HIPAA does at least provide a primary motivation to organizations to make sure that they are doing what they should be doing to at least align with the regulations that have been set out. Now, the first step of this, and this goes to the same point I mentioned about a standard, the first step of this is, well, how do we know how we're performing? So OCR are very clear. One of the key things that they specify is every organization must go through some form of a risk assessment. And this is important because, again, having dealt with OCR many occasions, they're not out there to try and penalise companies. No, it's not a politically positive thing to have a whole bunch of hospitals and health systems closed down because they're not operating in line with HIPAA. That's not really what OCR are trying to do with their enforcement. They're trying to make sure that organisations are operating in a responsible way. Right? Step one to that is you don't know what you need to do until you've done some form of assessment. So, the OCR do actually provide a basic HIPAA risk assessment tool on their website, and they've defined the specific steps that you follow. Again, there's all the different regulations are there, and there's a series of questions and controls that you can follow through on the risk assessment tool. And the idea really here is that, you're motivated to understand what gaps you might have against the regulations with a view to addressing them. Now, again, precedent often becomes a driver in terms of the types of enforcement actions that are taken by OCR. And what we can see from the enforcement actions that OCR have taken over the last few years is the one thing that they will typically call out if you want to get yourself on the wrong side of OCR is not if you have gaps within your HIPAA program. It's if you've never even conducted a risk assessment, then how do you even know how close you are to operating in line with HIPAA? And so they'll regularly come across organisations, and when they've had some sort of breach or there's been some sort of investigation, and they'll go and do a further investigation into the organisation, and they find that the organisation hasn't even conducted a risk assessment to understand what they have in place, what they don't have in place. OCR basically view that as an egregious non-compliance because that doesn't even show effort. If you've at least done a risk assessment and you've identified that you have gaps within your program and you can at least demonstrate that you're working towards filling those gaps, obviously you're still going to have to cover the costs of remediation and notification of the patient, but you're less likely to get a significant fine from OCR because they at least understand you're moving in the right direction. But if you haven't even conducted a risk assessment, then it's very difficult for you to make that argument to say that you are trying to be to operate in accordance with the HIPAA regulations. So again, it's important to understand, if you do nothing else, make sure that your organisation has conducted a risk assessment. Now, again, once you've done that, it's going to identify gaps, and you obviously want to put a plan in place to try and remediate those gaps. But you don't think that sticking your head in the sand and the whole argument of I didn't know is going to save you, because again, OCR have demonstrated time and time again that that is not going to be an excuse. Now, importantly, don't then think, let me just go to the OCR website, download the risk assessment tool, and if I do that, then I'm good. Even their own website, their own tool, carries a disclaimer that says, just conducting this risk assessment in itself does not mean that you're going to be HIPAA compliant, because again, they view this in the rearview mirror based on a subsequent investigation. So again, this is just the first step, and it's important that you follow that through and that you, again, follow the risk assessment on their tool. But again, my recommendation to you, again, is pick a standard or a framework that is more complete, and then build HIPAA into scope, and you're much more likely to have a more complete security program in place. And just to kind of reiterate that point, HIPAA requires that covered entities and business associates conduct a risk assessment of their healthcare organisation. So while we talk about the requirement to conduct training, again, that's very binary. You have to do it if you can't demonstrate you're doing it. Likewise here with the risk assessment, if you can't demonstrate that you've conducted the risk assessment, that clearly is an egregious breach of the regulation. Okay, let's kind of just shift gears a little bit, because obviously we are also going through unprecedented times, and while obviously organisations want to operate in compliance with HIPAA, like any kind of legislative guidance or any kind of legislative act, HIPAA, as we talked about, was originally put into place in 1996. You go back to what type of equipment we had in place back then, what the internet was like back then, the iPhone didn't even exist back then, iPads. So the whole concept of telehealth, even back then, really was really just a concept and an idea at that particular point in time. Technology has evolved significantly since, even if you take into 2013, when the enforcement came in for high tech, a lot has changed in that time as well. And so the regulation is trying to adapt and understand to this ongoing technology, digitization of information. What's happened obviously in the last couple of months with COVID-19 is we've gone through this unprecedented event where the demand for remote services has gone through the roof. Now, I think that as an industry, the healthcare industry has talked for a long time about remote services, but it's been a slow transition. The healthcare industry is not the fastest adopting new technology, hence why they had to incentivize digitization through things like meaningful use. But certainly this drive for telehealth is basically going to put it into the spotlight. And so rather than try and come out with updated laws and regulations in regards to telehealth, OCR has issued guidance and issued some enforcement discretion that basically means that they're not going to that they're going to kind of turn a blind eye to possibly some organisations not following a lot of the disclosure information. Again, there are certain conditions that they've laid that out to. So again, they want the ability for organisations to be able to reach out to former patients. Again, we can't do contact tracing and the like if we don't have the right to reach back to people, whether they give consent or not. Again, it's really important that we have an ability to share information in the current situation, because again, that's between obviously local and federal authorities, as well as some business associates who are basically manage the components here as part of this. And then just the whole public health component around, well, how much information do we share with the media to get the message out? And again, there's been guidance issued on all those different areas, again, in a response to the kind of very unprecedented time we're going through. The result of that has been we've seen an explosion in the adoption of telehealth, as you can see. Time will tell as to how we basically evolve that. Clearly, I think what we've seen is that the regulations were probably moving too slow in the past, and there always is a correction. So maybe some of the relaxation might be a little bit too dramatic right now, and they'll eventually get that right. We have to determine what happens when the immediate pressing requirement, hopefully it dissipates at some point in the not too distant future. There's a lot of questions around what payment should be for these types of services, what the payment rate should be, how often people should be paid, what's covered within these services and at what rate, etc. And again, the thing that I think a lot of people always forget about is, well, we have a federal law with regards to HIPAA, there are lots of state and regional variations to that as well. And so all of those have to be taken into account as well when we're kind of looking at the longer term impact of this. The good news is I think that, that clearly OCR have demonstrated a willingness to be flexible, again, because they see the value and the merit of remote services, which are clearly a necessary tool in today's environment. And hopefully this is going to drive some updates and some changes and some modernization to some of the guidelines we have in place right now. Okay, again, this is a statement that came out from OCR, I think in March. We are empowering medical providers to serve patients wherever they are during this national public health emergency. We're especially concerned about reaching those at risk, most at risk, including older persons and persons with disabilities. So, they're driving this for the right reason. And it's important that they are flexible as we obviously start to do things that we've really not done in any scalable way before. So let me kind of finish up just with a couple of observations and takeaways that you can take away from the slide presentation. First of all, HIPAA is the law, right? We don't get around choosing to follow it. It's not optional. We have to apply to it for good or for bad. The regulation exists. Many people might argue that it's overbearing. Some people might argue it doesn't go far enough. I personally think in this kind of data-centric world we live in, the challenge with HIPAA is not that I don't think there's overreach in it. I just think it needs to be more specific, or it probably should tie more directly to some recognized industry standards. OCR specifically, again, when they're looking at HIPAA, tend to view compliance in the rearview mirror. What I mean by that is you can't go to OCR and say, hey, can you conduct an assessment or an audit for me? Well, OCR have done routine audits over the past. They're very few and frequent. They tend to be desktop audits, so they're reviewing data. They're not actually coming in like you would do with a security audit and kicking the tires and shaking the trees, so to speak. What they will typically do is they will investigate once a breach or report has been made. And so they typically do retrospective investigations into situations and events. And in that situation or event, they will tell you whether or not they believe that you've operated in line with HIPAA or whether you haven't. And that's important when you think about, we talked earlier on about training. If you believe that you're operating in line with HIPAA regulations because you're conducting annual training and you're training your staff and you're giving them that 2-hour, once-a-year training, and then you have a major breach and HIPAA come in and find out that your staff don't seem to be knowledgeable enough in terms of how they should be operating against HIPAA and general security provisions, they can still quite legitimately come back to you and say your training program is ineffective. So even although you thought you were doing it in line with HIPAA, they can very legitimately come back and say that it's nowhere near sufficient as well, and you can be penalised for that reason as well. Really, from my perspective as well, as I mentioned before, any organisation that has their primary security or privacy obligation to be HIPAA compliant really is showing a lack of understanding of what's required to build a security program, right? It really is not sufficient, right? Again, it's not defined, as I talked about earlier on, but oftentimes it doesn't cover enough control areas, and it doesn't require the organisation to do enough in order to build effective security. Again, it's a reasonably arcane set of regulations that hasn't been defined for today's very technically sophisticated cloud-based, mobile-based world. And so it really is important that organizations pick a more robust and up-to-date security framework. Again, they can build HIPAA into that. So again, we shouldn't be looking at HIPAA as our primary driver. And to the same point, if you really think that the only thing you can shout about is that you're HIPAA compliant, then that probably actually is more of a negative for your organization than a positive, right? Again, pick a framework around it. It doesn't really matter which one. There's pros and cons with them all. If you're in the healthcare industry, obviously there's a lot of organizations driving through HITRUST or SOC 2, which has various different trust categories. Again, pick one and then build on it. More often than not, you're going to find that you actually have to be compliant to multiple frameworks. Again, some customers, and obviously HIPAA, you have to meet the obligations there for federal reasons, but many of the states have their own enhancements or changes. We're already seeing on the privacy side things like CCPA and GDPR in Europe. And then obviously your customers themselves, you may have a customer that requires you to meet a specific, like NIST-CSF or some other requirement that they have that's specific to them. So it's unusual for an organization these days to simply just have a singular focus on one framework. And so it's important to understand how these different requirements fit together and work together. And if you're operating in different countries, again, Canada's obviously got HIPAA. You go to South America, you go to again, Asia, Australia. They all have different variations or versions of their own kind of security and privacy requirements as well. And again, because this then becomes more complicated, you probably want to use some sort of tool or some sort of capability to help guide this. Again, you don't want to have to be building this 5 different times. So if you were to use a technology or a tool like the Ostendio MyVCM platform, you can actually manage your overall compliance in line with regulations like HIPAA, as well as many other security and privacy standards and regulations. So just a very quick promotion in terms of what Ostendio MyVCM is: an integrated risk management platform. It allows organizations to build out their security program, so it gives them the template for building this out against over 100 standards and regulations globally. It then gives the organization the way to operate that, so they can operate their policies, their procedures, their assets, their people, their vendors, incident management response, etc. All the component pieces that you need to run an effective security and privacy program, you can manage and operate within the MyVCM platform. And then finally, because we have to showcase this out to, we have to show it to our executive team, to our board, to auditors, to the government. There's lots of different people that obviously need to see how effective you are being and operating against those specific frameworks. And again, if I want to run a HIPAA report, I want to run a SOC 2 report or a HITRUST report, again, I want to be able to demonstrate that as an organization, how well am I performing against the hundreds of controls that I'm, as an organization, having to meet, right? Every action within the platform is documented, every process is automated. Again, you are able to use the platform across the entire organization. And the whole reason for doing it is not just the additional flexibility and capability of the tool, but it's going to actually save you significant time. You no longer manage things in spreadsheets, no longer having to report various different API tools and pull information from lots of different resources. One platform to manage everything across your employees, your vendors, and your entire organization. So that's kind of really the main thing I wanted to cover today. Now I'm going to open it up for any questions, if anyone has any questions on any of the things I've covered.
Well, thank you so much, Grant. That was a really wonderful and informative presentation, so thank you very much for that. We do have a few questions that have come in, and the first one is this here. It says, my covered entity customer is asking me to sign a BAA, a business associate agreement, even though I do not have access to PHI. What should I do in this situation?
Yeah, it's a good question, actually, and I think the first thing to clarify is, again, whether you do or whether you don't. As I mentioned earlier on, PHI is a technical term, so you either do have access to protected health information or you don't. What I sometimes find, though, is that some organizations, when they say that they don't have access to it, what they mean is their organization has access to it, but they don't themselves have access to it. So maybe they believe that the information is fully encrypted in their core system, and that employees generally don't have access to it. We're looking to define this, and access to any kind of sensitive data can really be defined in 3 different ways. There's what we call actual access, which is access that you have in the routine basis of your business. So as an employee or as a user within the system, I'm going to see and access protected health information in the general routine run of my day. I can be a doctor, I can be a nurse, I can be someone who's basically providing patient services and guidances to patients. So in that kind of use case, it's pretty clear that I have general access. Then we have what we call theoretical access. And theoretical access is the one, especially if you're a tech company, that I come across the most, which is I don't personally have access to PHI. We do manage it on behalf of the client, but we don't see it. No one has access to it. And the example I like to give there about theoretical access is, if I'm the CEO of an organization and the systems are designed that means that I can't go into any system and actually, through my user profile, see that information, then I don't have direct day-to-day access to PHI. But as the CEO, I could ask someone in my tech team to say, hey, can you give me that information? Can you give me access to that information? Again, I'm not supposed to have access to it necessarily, but because that person is a subordinate, the likelihood is they're going to do what I ask them to do. I have authority over them. So I could theoretically gain access to the information. And the theoretical access is the one that normally throws people for a loop. If you can theoretically find a way to access that information because of your authority, because of your technology, again, then you have theoretical access to PHI. You still have access and you have to manage it that way. And then the last one is really incidental PHI. Again, we see situations where subcontractors or business associates say, well, they're not supposed to give me access to the information. But if it can be foreseen that through the process of going about your day-to-day, that there are situations where that information can be foreseen to be sent to you, then again, you have potentially what's called incidental access to PHI. So say, for example, you have a ticketing system and you make it very clear in your ticketing system that people should not upload PHI, but you find through the course of time that every now and then someone uploads a file or an attachment and PHI exists within that, right? Again, if you can foresee that that is likely to happen, then you have to assume that you have incidental access to PHI. Now, whilst that still has this binary concept of having access to PHI versus not having access to PHI, what you have to do from a risk management perspective varies significantly. Again, I have to put more protections in place if I have routine and regular access to PHI than probably if I have theoretical access or if I have incidental. Again, if I have theoretical access, I can write policies and procedures that say, hey, listen, all employees understand who should have access, who shouldn't have, and these resources can legitimately say to the CEO, no, I'm not allowed to give you that access. But those policies, procedures, and enforcements have to be in place. Likewise with incidental, the volume of incidental records that you're likely to access are going to be significantly lower. So again, the implications are going to be lower. So again, the risk profile becomes a lot less as well. So again, it's really important to understand that when you define, do I have access to PHI, you're answering those questions. And at the end of the day, as I mentioned before, This is really binary, right? You either do or you don't, right? And so actually, if you sign a business associate agreement, and as I talked about earlier on, that business associate agreement is directly related to PHI, theoretically, because you're making a commitment to something you don't have, you can theoretically promise whatever you want. I mean, I'm sure lawyers are probably going to disagree with that because they're not going to want you to sign extra documentation that's unnecessary. But again, if you're signing a business associate agreement that refers specifically to PHI, and you're 100% confident you're never going to have PHI, then there's an argument that says that you're not actually signing up to any additional liability.
Hmm. Okay, very, very good. Um, then we have another question here. It says, how do I know if I have done enough to be HIPAA compliant?
Well, again, that goes to the point I mentioned earlier on. There is no such thing as HIPAA compliant, and so you never know, and that's the question, right? The whole point of building any kind of security program is not to eradicate any risk. It's to understand and manage the risk that you have, and so this is always a quest to do better. Maybe an ultimate arbiter might be whether you have a breach or whether you don't have a breach, whether you have some sort of issue. But again, you can still, the average breach takes between a year and a half to 2 years to discover. So you don't want that to be the judgment call on whether you think you're doing enough, right? What you really want to do is, if you effectively understand your risk, and that's again conducting the risk assessment and being able to quantify the risk that you take. What's the likelihood of something happening? What's the impact when it does? And quantify that across your business. You want to then define that to an acceptable risk profile, right? Again, do I need to protect my public website and the information there to the same extent that I need to protect my electronic health system, right? Clearly, one has more valuable data than the other, and one has a greater risk, is more a source of attack, and has more implications. So I want to be able to do there than I did. So, and you can't do everything. So, yeah, you're never really going to know whether you're doing enough. The best you can do is make sure you understand your risk and make a determination as to what you consider to be an acceptable risk. And hopefully, if you make that determination well enough, then you're going to avoid any incidents that are going to get you into trouble.
Right, like there's no certificate that says I am HIPAA compliant, and you can't put it on your website that says, like, the marketing people can't say we are HIPAA compliant. People have gotten in trouble for those type of things because maybe one day or this hour you might be HIPAA compliant, but then who knows if there's going to be a breach tomorrow or something
It's
like
even,
that, right?
there are many organizations, unfortunately, they do put on their website that they're HIPAA compliant, and they even have little certifications. And I even know some organizations that claim to make you HIPAA compliant as well, unfortunately. But you're absolutely right. It's a journey. It's an ongoing journey.
Right.
And you have to make sure that you're just continually evolving and doing as much as you can at any particular point in time.
Correct.
You've never arrived at a destination.
No, it's an ongoing battle, and right, right. Um, so here's another question here. It's, do I still need to be HIPAA compliant if I don't have access to PHI?
So yeah, so go to the previous question. So again, I'm going to skip over the HIPAA compliant part again as well.
Mhm.
Again, HIPAA and PHI come hand in hand, as I mentioned earlier on. PHI is a term that's inextricably linked with HIPAA. Therefore, if you're not managing PHI, HIPAA does not apply. And the best case of that comes out is if you think about a lot of the people that organizations that manage personal health records, right? So if Google has I mean, Microsoft Health Vault has been retired, they don't have it anymore. But they're a good example where if you're providing your personal health information into a private company who's managing that personal health information for you in some form of PHR, PHRs do not actually fall under the jurisdiction of HIPAA. Because again, going back to the definition earlier on, there's no provision of care or service, right? They're simply just managing your data. So again, information that's, even if it's sensitive, identifiable health information that's stored within a PHR is not PHI. Because again, PHI by definition has to be, again, identifiable health information that's basically that comes through the delivery of care from a covered entity. So again, yeah, no PHI, no HIPAA.
Okay. Here's a here's a good question that I know a lot of people are curious about. How responsible am I for my vendors' compliance under HIPAA?
Yeah, so that's a great question. And again, a big part of what the final omnibus rule was trying to do was to try and close that loophole. Prior to the final omnibus rule, the key requirement was for covered entities themselves to actually make sure that their subcontractors met the requirement, and the responsibility, completely was on the covered entity to do that. Now, that said, um, the covered entity cannot do it, or an organization cannot do it for their subcontractor. So basically, the way that this is defined right now is OCR have kind of come out with various different guidance and adjudications on this. What they're looking for is any organization that is subcontracting out data, whether it's a covered entity to the business associate or a business associate to a subsequent business associate. They had, it's that word reasonable again, they have to make reasonable steps to ensure that subcontractor is meeting or exceeding the same set of standards that you as an organization are doing. And what that basically means is, if you sign a business associate agreement with your covered entity, you have to make sure your subcontractor has signed the business associate agreement as well from you to them as well. And that business associate agreement that they're signing cannot be of lesser extent in the terms of the terms than the one that you've signed with your covered entity. Now, where it starts to become a little bit more vague is, okay, if your subcontractor signs the business associate agreement and you know that they're not able to meet that or comply with that, but they've signed the agreement, what's your responsibility at that point? And that's been a little bit murkier. OCR haven't really come out strong in terms of the requirement for organizations to enforce business associate agreements in terms of making sure that they're doing it. So while you're technically responsible, the responsibility for the most part is a good faith effort to make sure that your subcontractor is at least telling you that they're doing the right things. There's not a lot of precedent that OCR have come out and said, well, you should have known better, you should have known with your subcontractor. Now, that said, if your subcontractor has a breach, then clearly, again, that's going to reflect badly on you as well, because again, the PR aspect of it is a problem. But in terms of, how far you need to go to ensure that your subcontractor is doing what they say they're doing, again, is a bit of an open case.
Okay, very good. Well, we're getting close to time for questions, so I think if there's any follow-up questions, we'll take them by email. So I'm wondering, do you have any other advice for us or any other thoughts that you wanted to share with us today?
Yeah, I mean, I just reiterate, I think, some of the key themes that I mentioned, which is, look, HIPAA as a regulation has great intent, and there's no doubt that I see organisations are very motivated with the fact that the regulation exists there, and obviously the various different state forms. But it really is important to appreciate that, well, HIPAA absolutely drives certain behaviours. I mean, I think the biggest impact it has is that large institutions and healthcare providers obviously are obligated to ensure that their subcontractors, again, are signing business associate agreements. And we see that from a marketing and PR perspective, these organizations want to go out and meet the requirements of HIPAA. But it isn't enough. And organizations, again, who are simply just focused on HIPAA are really missing both the intent of the regulation and are really not building a secure organization, because you're never going to be able to build effective security into your organization if you rely entirely on the HIPAA regulations themselves. And so again, I would encourage any organization again just to look at other frameworks, again, like HITRUST, like SOC 2, even the NIST standards themselves, and use some sort of other framework to again use those as a way to try and build an effective security program. And if you do that, for the most part, you're going to meet most of the regulations of HIPAA.
Okay, wonderful. Well, thank you, Grant, so much for being here today. I very much appreciate it.
You're welcome. I enjoyed it. Thank you.
Thank you. And thank you, attendees, for being here today as well. Please use the contact information on the screen for any questions if you have any further ones, or you can send us questions if you think of them later, and we'll forward them on to Grant and the team at Ostendio. Please remember your PAYCOM and your PMI CEU certificate will be emailed to you from within 2 days following the broadcast. There's no need to request it separately. You'll get it automatically. You can register for future webinars or request a demo of our compliance solution on our website at firsthcc.com or call us at 888 543 4778, and thank you for joining us.